Welcome to the recorded version of the Grantmakers and Aging web seminar, Diverse Elder Communities, Challenging Issues, Innovative Responses, featuring Stacey Easterling, Program Executive with U.S. Aging, Christine Takada, President and CEO of the National Asian Pacific Center on Aging, and Michael Adams, Executive Director of SAGE, Services and Advocacy for LGBT Elders, and John Feather, CEO of Grantmakers and Aging, from June 28, 2012. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, and the Atlantic Philanthropies. Technical and production support is provided by the American Society on Aging.
Thank you again for joining us today for Diverse Elder Communities, Challenging Issues and Innovative Responses. We've got a very engaging program for you today, and to take over the reins of the moderating, I would like to welcome John Feather, who is the CEO of Grantmakers and Aging. Welcome, John.
Thanks very much, Steve, and welcome everyone to Conversations with GIA. This is part of our continuing series of monthly webinars on critical topics of interest to funders in aging. As Steve said, my name is John Feather. I'm the CEO of Grantmakers and Aging, and I'm delighted that so many of you have joined us today. To get us going on today's session, I'd like to pull up a couple of poll questions for you to look at. And if we could look at the first one, we know that the 65-plus population will double in the coming decades. Today, 1 in 5, or 20% of older adults, are persons of color. By 2030, that percentage will be A, 1 in 2, or 50%, B, 1 in 3, or 33%, or C, 1 in 4. So please go ahead and vote on the poll. All right, if we could see the results. Well, we had a diversity of answers, but actually the correct answer is B, 1 in 3. But I think you all have the sense that the increase will be a very substantial one over the next 15 to 20 years. So if we could look at our second question, among the issues facing older persons from diverse communities are A, access to appropriate services, B, economic vulnerability, C, increased health risk, or D, all of the above. So if you could please choose your answer for that one. And if we could look at the results. Well, we've got a very, very smart crowd here, and I think as you know, all of these issues are important ones for diverse elder communities, and we'll be talking about these in more specificity as the session goes on today. So I want to welcome you once again to this session, and before we begin the formal discussion, I want to thank two of our members for their support in making today's webinar available free of charge to funders in aging. The John A. Hartford Foundation of New York is providing continuing support for this series, and the Atlantic Philanthropies of New York is co-sponsoring this month's webinar. We also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Now to today's topic. As we know, policymakers and aging service providers face a wide array of opportunities and challenges as the older population in the United States continues to grow. What is often overlooked is that an ever-increasing proportion of older Americans hail from people of color, American Indian and Alaska Native, and or LGBT communities. Members of these diverse elder communities face particular challenges. Moreover, their life experiences and perspectives offer uniquely valuable windows into essential new ways of thinking about aging policy and service delivery. Today we want to learn more about the unique issues facing members of the diverse elder communities, the innovative and successful responses that are emerging to meet those needs, and the role of philanthropy in addressing them. We have several experts with us today, and we are happy to have Christine Takada, President and CEO of the National Asian Pacific Center on Aging, the leading nonprofit service and advocacy organization committed to the dignity, well-being, and quality of life for Asian American and Pacific Islanders as they age. Michael Adams, the Executive Director of SAGE, Services and Advocacy for LGBT Elders, the oldest and largest organization in the country dedicated to transforming the LGBT Aging Experience, and representing Philanthropy, Stacey Easterling, Program Executive, U.S. Aging at the Atlantic Philanthropies, whose work focuses on supporting social action and economic security of older adults, particularly in communities of color. Welcome, Christine, Michael, and Stacey.
Thanks, John. Thank you.
Michael, let's start with you on the next slide. A number of groups already have formed to meet the needs of the growing diversity of an aging population. Could you tell us who's come together to form the Diverse Elders Coalition?
Sure. Well, as the slide indicates, we have 7 organizations that form the Diverse Elders Coalition, including the Asociación Nacional Pro Personas Mayores, the National Asian Pacific Center on Aging, the National Caucus and Center on Black Aged, the National Hispanic Council on Aging, the National Indian Council on Aging, SAGE, or Services and Advocacy for GLBT Elders, and Southeast Asia Resource Action Center. So these are 6 national people of color aging organizations, and SAGE, the country's only national LGBT aging organization. And some of our organizations have worked together previously in other contexts on a bilateral basis, and some of us, in fact, were new to each other when the coalition was formed within the past couple of years. But this is the first time that these 7 organizations and the diverse elder communities that we represent are joining forces in advocacy and education.
If we could have the next slide then. Why did the Diverse Elders Coalition decide that now was the right time to come together?
Well, you know, some of it is about demographics and numbers, as the slide indicates, and as was referenced earlier in the questions. We see and know that the proportion of our elder population that is people of color is growing very, very quickly. So it was indicated earlier that whereas today 1 in 5 older people is a person of color, that will increase to 1 in 3 by the year 2030. And with the number of LGBT elders, which today stands at approximately or at least 1.5 million, is going to double to at least 3 million by 2030. So some of it is about numbers and demographics, but the timing was right and compelling for this coalition for other reasons as well. You know, I think as we all know, this is a very challenging time for aging organizations, for the aging network, and for elders in general, you know, where bedrocks like Social Security and Medicare are threatened, government funding for programs is shrinking. So it was a great need for effective and coordinated advocacy. And at the same time, our diverse communities and organizations are stepping into their own. They're creating innovations, and we're ready to be part of the solutions. And the more the leaders of our organizations and communities have talked together, the more we've realized that we have many shared interests, and it just makes sense for us to band together in this coalition.
That's great. And on the next slide, how are diverse elders different in terms of economic factors?
Well, they're different in a variety of respects, and in general, people of color elders and LGBT elders are significantly more vulnerable from an economic perspective, and this is due to lifetimes of discrimination and marginalization and other social realities that lead to higher poverty rates and diminished retirement support. And some of the illustrative statistics that are represented here in the slide really start to tell the story. You know, so for example, African Americans make up 9% of the older population, but make up 21% of the elder population living below the poverty line. And between 16 and 21% of AAPI elders from some subgroups are living below the poverty line, compared to 10% of the total elder population. We see 1 in 4 American Indians living in poverty. Access to workplace retirement plans is significantly lower for all people of color elders, including Hispanic employees. We see higher rates of poverty among LGBT elders in general, and especially among lesbians, so that lesbian couples 65 and older are twice as likely to live in poverty as married heterosexual couples of the same age. So really, we could offer any number of statistical analyses that demonstrate that from a whole variety of vantage points, there is a significantly higher level of economic vulnerability among diverse elders, people of color elders, and LGBT elders relative to the older population in general.
Christine, let's move on to you on the next slide and talk a little bit about the health challenges facing these communities. What are some of the issues concerning the health and health care of older people from diverse communities?
Sure. So just to build on what Michael has laid as far as the economic vulnerability facing diverse elders, there are also higher rates of chronic disease and health inequities among diverse elder populations compared to their white peers. We have Native American, elders of color, and LGBT elders with higher rates of diabetes, cardiovascular disease, HIV/AIDS, and other chronic diseases. LGBT, Native American, and elders of color also experience lower levels of general mental health and have higher rates of depression and stress. The suicide rate among Asian American and Pacific Islander women age 65 and above is actually the highest among any of the population groups. And of course, cuts to Medicare and Medicaid have a direct and disproportionate impact on elders of color. You can see the statistics. 52% of African Americans age 55 and above are dependent on Medicare, as are 46% of Latinos, 43% of Asian American and Pacific Islander elders.
If we can go on to the next slide then. So the health issues are obviously among the major challenges. Are services available for these communities?
So while services are available, diverse elders definitely face additional barriers in accessing the services. As Michael mentioned, poverty is a critical factor. It impacts the quality of life of our diverse elders. The higher rates of chronic disease and other health inequities also contribute to a greater need for services. But also Native American, people of color, and LGBT elders often cannot use mainstream services if they're not culturally or linguistically adapted to the population. Provider knowledge and understanding of diverse populations is also critical for appropriate services. For many of the populations, there's a fear of service providers who may lack the knowledge or understanding or even a common language through which they can communicate. And then lastly, there's inadequate funding of services that are specifically designed for serving diverse elders.
Okay, as we move to the next slide then, I want to remind our audience that you have an opportunity to provide questions which will provide the second half of our discussion today. There's a box on your screen there, and if you just type in your questions, I will be asking those of our panelists later on. So please feel free to go ahead and begin putting questions in at any point. So Michael, policy issues would seem to be particularly important for this population. How is the Diverse Elders Coalition working in that area?
John, you're entirely right that policy work and policy reform is extremely important for diverse elder communities. The kinds of issues and challenges that Christine and I are describing are things that really need to be addressed through policy reform. Repeatedly over and over again in so many different contexts, we see that aging policy really does not take account of the needs of people of color elders and the needs of LGBT elders. So that's clear, that clearly needs to be and is a very, very substantial focus for the Diverse Elders Coalition. Obviously, we have come together as our 7 organizations to focus in on policy advocacy. For us, building partnerships and building collaborations is a big focus of our strategy, and that's not limited to our 7 organizations coming together. We know that we are more effective as organizations working together, but we also know that we cannot have the impact that we need to and want to have on policy unless we work closely with the Aging Network, unless we work closely with key partners across the spectrum who really are at the policy tables that we need to be at, that are in the policy discussions that we need to be part of in order to make a difference. And so, one example is that the coalition and our member organizations work extensively through the Leadership Council of Aging organizations and other fora in order to really to broaden the discussions to include the interests and the needs of diverse elder communities, and our presence there, our participation at LCAO is critically important. Partly we are all aging organizations, so we have a tremendous interest in the general array of aging policy issues that come before LCAO for discussion. It's also really important, though, that we bring the specific issues that are especially relevant to diverse elders to the table in a context like the Leadership Council of Aging Organizations, because often, unfortunately, they're otherwise not considered. And we also work with all kinds of other coalitions and partners in order to make sure that the important work that these networks and coalition does, again, pays attention to the voices and the perspectives and the particular needs of diverse elders in their advocacy work and their communications work. So, a couple of examples are, mentioned on this slide is we've worked closely with Social Security Works to really try to be a part of the effort to ensure that Social Security as we know it is preserved. It's an incredibly important source of benefits and retirement income for elders from all of our communities, and in fact they are especially reliant and more reliant than older people in general on Social Security benefits, and so we need our voices in that context. So we're working with an organization like the Medicare Rights Center, which is focused both on advocacy to protect and support Medicare, but also advocacy to encourage individual elders to be empowered within a system as complicated as the Medicare rights system. So much of our work when it comes to policy advocacy is focused on this kind of partnership and collaboration.
Well, Michael, this is obviously a very interesting and important day in looking at federal policy. If we go to the next slide, how does the Diverse Elders Coalition advocate on the federal level?
Well, our advocacy is at the federal level is really focused on the key areas of federal policy that drive benefits, that drive access to care, that drive access to services for older people. We do that in a variety of ways. So, for example, the coalition advocates at the federal agency level for both policy changes and also for equitable distribution of funding for local aging programs that serve our community's needs. I mean, so often what we see, obviously resources are very hard to come by in general. It's a very difficult time to obtain resources for programs. And having said that, what we so often see is that the programs that have been designed and that are most effective at serving the needs of diverse elders often are those that are least funded, that are least positioned for support. And so a part of our work is advocating with federal agencies like the Administration on Aging for equitable funding streams and funding guidelines. We also work as a coalition. We work in Congress to advocate for legislative change where appropriate. And so there, for example, a big priority for the coalition is around reauthorization of the Older Americans Act. As a coalition, we have a shared set of policy priorities that focus on making the Older Americans Act more responsive to diverse elders and their needs. And then, and this is especially appropriate in light of the news from the Supreme Court this morning, we advocate for effective implementation of key legislation. And here, a big focus of our time over the past year has been implementation of the Affordable Care Act so that it's responsive to the needs of diverse elders. And, of course, we were all wondering until this morning whether that was time well spent or if that legislation was going to be struck down. Of course, it's been upheld in all parts by the Supreme Court. And so that is such an important piece of legislation for our constituents because of the health challenges that Christine was describing earlier. So, for example, the National Prevention Strategy that was mandated by the Affordable Care Act is one that we did a tremendous amount of advocacy around to ensure that blueprint for a health policy for the country moving forward would explicitly talk about the particularized needs of diverse elders, and fortunately it does. So those are some examples of how we work on policy advocacy.
Christine, as we move to the next question, I want to remind our audience once again that they can send in questions by typing it into the box on your screen, and we already have a few questions, so I'd love to have those. We'll be coming to those at the end of our session today. But Christine, we're glad to have this webinar where we can talk about the issues facing these communities. But how else do you reach out to those who need to know more?
So each of the DEC member organizations is very active within their own populations that they serve. So it's very important to remember that while we are all national organizations, we're also very closely tied on the local and regional levels to the organizations that are serving more directly on a grassroots level. But as a coalition, we're very active. We issue press releases and through media work. The coalition weighs in on key issues such as the strengthening of Social Security that Michael mentioned, and other issues like Medicare, Medicaid, any reforms or changes that would impact diverse elders. The coalition is very active on a public level, taking positions. And members have also contributed to important policy discussions. There have been analysis on the impact of Social Security reform on the diverse elder population. Our member organizations have contributed to that. We are in the process. There will be a dissemination of a policy analysis on advancing economic security for diverse elders that the DEC has been working on for the past few months. And soon we'll be launching a dynamic social media platform, a website and blog for diverse elder perspectives that should be coming out next month, and it's www.diverseelders.org. And also DEC is very active in educating and informing elected officials through Capitol Hill visits, briefings, and again, through our networks nationally.
Well, you're obviously very busy already, but as we see on the next slide, how else do you reach out to new audiences?
So DEC considers ourselves a very important resource for stakeholders on many levels. Members and as a coalition, we're actively advising and supporting the philanthropic sector, for instance, by presenting in conferences including GIA Annual Conference, the American Society on Aging, as well as other local and regional conferences. Our members and the coalition contribute to philanthropic publications and also through social media and through technical assistance. The group also is active in advising corporate as well as public sector on diverse elder needs and perspectives. We're very actively targeting meetings, so we're having important discussions on topics such as potential impacts of policy change, whether it be about Medicare reimbursement policy issues or possible changes to Medicaid coverage. And then lastly, the organizations and the DEC members are constantly taking the pulse of the elder communities who we serve, again, by staying connected through the local networks across the country. And each of the DEC member organizations, we have partner organizations on the local level that we work with to collectively support and serve our elder populations.
Great, and I think the opportunities that you talk about are going to be increasingly important to the larger aging community. On the next slide, Michael, reaching out on these national policy issues is critical, but obviously you also are working very closely with local and regional and national members of these communities. So how do you empower older leaders from these communities themselves?
Yeah, this is really key, and it's an important topic to touch on. You know, unfortunately, elders from all of our communities, our diverse communities, are too often have been marginalized, and it's important that we provide platforms to empower diverse elders. I mean, we know from our work, from the work of all of our organizations, that they are their most effective advocates. They most understand their experiences, and they're most powerful at sharing their perspectives. And you know, as Christine has referenced, although you know we are national organizations, we are very much also rooted in local communities and work with local organizations across the country. And so, you know, working with our partners and then the work that we do locally, we are able to engage with and support and empower constituents from all of our diverse elder communities. So, there are numerous examples. So, one that stands out is the National Hispanic Council on Aging's annual constituent conference, for example, which takes place in Washington, D.C. every year and brings together hundreds and hundreds of Hispanic elders from around the country who come together to share information, to develop new strategies, to be trained in new advocacy skills. And it's no accident that that conference takes place in Washington, D.C. The NHCOA constituents participate, and they go up to Capitol Hill and meet with their elected officials and staff members, et cetera. It's really a wonderful. It's really a wonderful effort in support of constituent leadership, and that a number of us actually who are not part of National Hispanic Council on Aging have had the opportunity to participate in and be speakers at that conference. We also, in the LGBT context, for example, the SAGE has a program called SAGE Advocates, which provides training and capacity building to individual LGBT older people so that they can be as effective as possible in telling their stories and sharing their perspectives. And historically, those kinds of programs have focused on, again, on meeting with elected officials and testifying in public hearings. But as things change and as technology develops, we're now starting to get into training around how do you do advocacy online? How do you engage in digital storytelling? All of these kinds of things which require new ways of thinking, new skills, et cetera. So across our coalition and across all of our organizations, there really are countless ways in which we are, as a coalition and as individual organizational members and communities, supporting elder leadership and elder empowerment.
That's wonderful. And before we bring in Stacey and the philanthropic perspective, I wondered if I could have Michael, you and Christine talk a little bit about a few local examples of programs that have worked well. So on the next slide, I think, Michael, I'll ask you to start with the first two and then bring in Christine for the later ones on the slide here.
Sure, absolutely. I mean, and in mentioning these in terms of context, really the reasons why the advocacy work and the education work of the Diverse Elders Coalition is as effective as it is because it's authentic and it's grounded in community experiences, both the local programs of our own organizations and of our partners. And so, as we said at the beginning, we are part of the solution to the challenges that we're describing. So a couple of examples of innovative programming that I'll mention here. One is the KP Gardens Project, which is a really interesting local program based in Minneapolis, which empowers Southeast Asian and other immigrants and refugees as community leaders through gardening and small-scale farming, with the goal of creating access to affordable, healthy, fresh, and culturally suitable food for low-income immigrants and refugees. And KP was launched in 2011, currently serves more than 60 individuals, especially elder, refugee, and immigrant women in their 50s and older. And in addition to the focus on food and on healthy and culturally suitable eating, the garden plots really have also become an opportunity to foster inter-ethnic collaboration and sharing among Hmong, Oromo, Somali, and American-born residents from refugee communities. The gardening project also is a means to connect elder clients to KP's, the organization's caregiver and elder care services. So that's one great example in the API communities of some innovative local programming. Another is Sage Harlem, which is based in New York City. Sage Harlem is the country's first NORC, or naturally occurring retirement community, that's based on affinity and identity, in this case LGBT identity, rather than geography. It serves more than 250 African American and Latino elders in the Harlem community who are LGBT. And the constituents participating in this program historically have been very isolated within their communities. So the program really focuses on bringing people together and building an LGBT affirming community in Harlem, and all kinds of activities from Spanish language, women's discussion groups, to knitting classes, to senior-led health education, to being out at Harlem Pride and doing tabling for other LGBT members of that community. It's really a very, very exciting and innovative local program.
Christine?
Sure, and another example of a successful program would be Salud y Bienestar, or Health and Well-Being, run by the National Hispanic Council on Aging. They implement the program in Texas, Washington, D.C., and the state of California, and it's an evidence-based program that focuses on diabetes education. It builds the relationship between the elder and the healthcare provider, which is a very important link that's often missed, which does contribute to the lack of access issue that we talked about earlier. The program uses a culturally, linguistically, and age-sensitive approach, and the purpose of it is to address the needs of approximately 2.5 million Hispanics who have diabetes. So this is another very innovative program that we are very supportive and pleased to see among our member organization. And the last would be, in 2005, NAPCA developed a national toll-free Asian language helpline, and this is in Cantonese, Mandarin, Korean, and Vietnamese. And the purpose of the language line was to help limited and non-English speaking elders, Asian language speaking elders, to enroll in Medicare Part D after the Medicare Modernization Act went through their major changes. Since then, we've also expanded our written materials beyond Chinese, Korean, and Vietnamese to include Khmer for the Cambodian seniors and also Samoan.
Those are all wonderful examples of how local programs and national programs can play such a tremendous role. Stacey, at this point, I want to turn to you for a minute. Since we're talking to an audience of grant makers, I want for us to focus for a little while on questions about what funders can do in this arena. The Atlantic Philanthropies has supported the work of the Diverse Elders Coalition and the individual groups. Why was this important to Atlantic?
John, thanks for the opportunity. And we wanted to, at Atlantic, pursue our strategic priority, and one of those was to strengthen the voice of older adults. And for us, that meant strengthening their advocacy capacity. We were particularly interested in amplifying the voices of underserved and invisible elders, such as elders of color and LGBT elders who often don't have voices that are heard. We did our research and identified these seven national organizations that represented diverse constituencies. Some of the things we found when we met and got to know these groups is that many of them were very inadequately funded and had funding primarily coming from one or two sources, mostly government grants. They were pulled in multiple directions, being representatives of their communities. They were attempting to be everything to everyone. They were feeling that they were missing out on direct exposure to funders and philanthropic dollars because most of the funds for addressing diverse community needs are often given to mainstream aging organizations, and these groups would sometimes only be brought in at the end to offer support. And then overall, each of them were, as individual organizations, their voices were not very loud or influential as they hoped those to be. So what we wanted to do was we wanted to work to strengthen that capacity. So we developed an initiative that supported capacity building, both at the organizational and advocacy strength. The seven organizations were each given grants, and then we also provided support for the convening and the operation of the collective that would support work on common policy agendas.
All very important things. And if we go to the next slide, we will ask the question that probably some of our audience is thinking about, which is it's a wonderful thing that Atlantic Philanthropies has done this work, but most of the organizations who are members of GIA and are listening today work at the local level, and very few have the resources of Atlantic. How can they be involved in this work?
Yeah, I agree that there are very few and far between large national organizations that can put the dollars into this type of work. But I think there are other ways that this doesn't have to be exclusively, the work of large national foundations, and there are ways that regional and local funders can engage and this work can be low cost and still result in high impact. I'd suggest and believe that there are ways such as collecting or supporting the collection of data that provides a clear picture of the changing demographics in the region. Funders getting to know how they're being impacted by these changes, I think, is a good start. Second, funders might consider supporting needs assessments, listening sessions, or focus groups that capture more intimate information on the needs of diverse elders in their communities. Third, I'd recommend supporting capacity building or of organizations that focus on diverse elder needs, or supporting mainstream groups collaborating with diverse serving organizations, with funds perhaps going to both of the groups rather than always deferring to the mainstream groups. And then finally, I think funders can start with a very low-cost effort in making addressing diverse elder needs a stated priority. They can communicate this fact to their applicants and hold them accountable to serving these populations when they're applying for funds.
I know that you, Stacey, have been involved in this work personally and certainly with Atlantic Philanthropy professionally for many years. What have you learned from working on this issue? And what advice would you have for other funders who are interested? And that'd be on the next slide.
First, I'd like to say that funders need to know that this is hard work and that a lot of these type of configurations may not come naturally. Funders may have to take the initiative to start by convening and introducing the idea of collective work. Like the DEC, we approached these groups and said, hey, we have an idea of a collective action that you can take together to be stronger than the separate voices. It takes time, so it is hard work, but it's well worth the work. Second, I'd say funders need to stay the course. As much as we say this, it is true. This is a long-term investment that will not yield immediate results, but we have changing demographics in our country, and they demand that we look at the needs of diverse elders over a long view, and funders have to be ready for that, and I think a long-term investment is really the key. Third, I'd say that there's a strong potential for high impact on this kind of work, and high impact and cost effectiveness in this kind of work. In this economy, investing in addressing these type of issues is important, so we need to think about ways to be efficient and effective. And the example of the DEC was one that we thought was effective because we were able to support groups that 7 different groups, but able to have the impact when the collective came together that we believe is cost effective. So I think that there is a way to look at this that can yield high impact but low cost.
Well, thank you for those observations. We wanted to introduce one last slide before we go to the questions from our audience, and a reminder that you can send in your questions. This has already been mentioned once, but Michael, could you tell us again when the new website launches and what will be on it?
Sure. The Diverse Elders Coalition website launches the week of July 16th. It is going to serve as a news and information blog with original commentary and news about the issues facing diverse elders. And it's the first site of its kind. Contributors to the site will include policy professionals from organizations who are members of the Diverse Elders Coalition, as well as other leading experts in the field who are working on these issues. It will have weekly postings. It's also going to have a virtual library of publications related to diverse elders. It'll have detailed analysis and recommendations on various policy issues from the coalition's perspective. And later in the year, we will be launching a digital storytelling booth that will begin collecting the personal stories of diverse elder people and their loved ones from around the country. And one more thing I'd mention is that it was going to be the launching pad next month for a new white paper by the Diverse Elders Coalition, which is focused on economic issues and is called Securing Our Future, Advancing Economic Security for Diverse Elders.
Those are all wonderful things, and we look forward to seeing this new and exciting effort. It's now time to turn to questions, and I have a number of questions from our audience, so I will just start going through those. The first question is around, are there members of this group or others who are addressing the long-term care system's inequalities and discrimination in treatment in these populations? I don't know. Christine, do you want to take a stab at that one?
So each of the organizations is focused and has varying capacities, as Stacey referenced. I would say specifically as national organizations, I think we're very strong advocates. As far as direct services, I don't think that many of us are doing very specific issues on that, except more on a policy and advocacy level. Michael, would you agree?
Yeah, I think that's right in general. I think one of the roles that all of our organizations are playing in varying degrees is a role at the local level to work with long-term care providers in order to help them become better, really, at providing services to members of our diverse elder communities. And so most of our organizations, as individual organizations, have training programs. So at SAGE, we have something called the National Resource Center on LGBT Aging that trains providers, including long-term care providers. A number of our other organizations have important training programs as well. And those training programs really, at this point, I think are become the primary means for us to influence providers. And then as Christine mentioned, of course, then, we can look for the opportunities to have influence on the policy side as well.
Okay. An interesting question from today's kind of momentous decision this morning, and to some degree, for many people, somewhat surprising decision this morning about the Affordable Care Act. I wondered if anyone on the panel would like to comment on the decision and what you think it means to the diverse elders community. Michael, you said it. You started a little before. Christine, you want to start with that and have Michael follow up?
Sure. I mean, we spoke a little bit or maybe at length about the health inequities and the access issues that our populations face. So absolutely, we are in support of any legislation, including the ACA, that is going to be about opening up access to elders. There's a very important component of the ACA that focuses on culturally competent services and the disaggregation of data, which is a very, very important issue to our populations. There are many instances in each of our populations where there is inadequate data to actually reflect what's happening in our populations. And when policymakers or funders are looking at our populations in aggregate form, it's very difficult to make responsible and accurate decisions. So the disaggregation of data is something that we very strongly support, and it's very important to our population.
Well, I think especially in the Asian Pacific Islander community, which, we talk about it as if it were a single group speaking the same language and having all the same cultural influences, which obviously is not the case. Michael?
Well, we certainly at SAGE, we were thrilled with the decision this morning. SAGE joined a number of other LGBT organizations in participating in a friend of the court brief in support of the Affordable Care Act. And the reason for the general focus of the LGBT organizations is because we know that LGBT people in general have an array of health disparities that are faced. And so expanding access to care in the way that the Affordable Care Act does is extremely important to LGBT folks in general. In particular, with regard to LGBT elders, I couldn't agree more with the points that Christine made about the central importance of expanding access to not just to care, but to culturally competent care. And there are provisions within the Affordable Care Act itself that address that. And there are also all kinds of opportunities in implementation of the Affordable Care Act for the Diverse Elders Coalition and our organizations and others to get in on the ground of implementation and make sure this is a massive undertaking in our healthcare system. And there are so many different ways that we will be able to help to shape it so that it responds to the needs of our constituents. So we're just thankful we'll have that opportunity now that the court has ruled that it's constitutional.
Right. Just to remind everyone that the bill itself, or the law itself, is, of course, very long and complicated, but they're expecting to have over 1 million pages of federal regulation now to be written to implement the law. So there's a lot of opportunity to have an influence on what actually gets put into place as we move forward.
Stacey,
yeah.
Can I add a quick comment just to say, sort of from a funder's point of view, that a lot of us that are looking at health and aging are looking at implementation. Sort of we've passed this obstacle. Now we have to look at implementation and making sure that it's carried out in the right way. And one of the things we're looking at in particular are the most vulnerable elders and how they are impacted by this, making sure they have access, making sure they have quality care. And we're particularly interested in the dual eligibles who are low income, receiving Medicaid and Medicare, and a majority of them are elders of color. So funders can look at those issues and look at those populations and see how these folks are affected by the ACA. We're looking at that, and how does the fact that the majority of vulnerable elders are people of color, and how do we factor that into the implementation and still keep the quality and cost of health care, in check.
Right. And obviously an enormous need now that we're moving forward to have reliable information going to all of our communities. The next question is around coalitions that are state-based, and this one is particularly around coalitions that are in California. Are you involved either collectively or individually with California-based coalitions, and how do you see working together with state-based coalitions?
Who should start, Steve?
I'll let you go, Michael.
Okay. Yes. Certainly. I mean, California is a focus of the work, I'm going to guess, of all of our member organizations. And as the Diverse Elders Coalition, a number of our organizations have together been in conversation around, for example, paid leave and the issue of paid leave and how we might work together to advocate on that with a particular focus in California. At SAGE, we work really closely with California coalitions on a number of issues, for example, around expansion of spousal impoverishment protections and Medicaid and issues of that sort. And in terms of the coalition's policy work is primarily focused at the federal level. And so in that sense, our coalitions are more federally focused. But I think across our individual organizations, I certainly know firsthand that with a number of them, state-based coalition work is extremely important. In California, is often in the lead in the kind of advocacy work that each of our organizations does, and so we're lucky to be part of that.
Christine?
Sure. Yeah, I agree with Michael. A number of our organizations have direct services and offices or are even based in the state of California. So definitely the state of California activity is very important to many of our individual member organizations. I would agree that as a coalition, when you have 7 organizations, it's as Stacey mentioned, it takes time to really sift out what are the common priorities that all 7 organizations can fully support. So while each of our organizations do rely very heavily on state networks, including the state of California, as a coalition, I do think that we also have to be kind of realistic in how we move forward as a collective. And so we do focus more on the federal level as a coalition.
Okay. Stacey, anything to add to that one?
No, I think they summarized it well. Thanks.
I think we have probably time for one more question before we wrap up, and that's a question on caregiving. Obviously, this is an enormous issue across all of the aging field, but there are particular issues for the culturally and linguistically diverse older adults. And I wondered if you could talk a little bit about the work that you are doing collectively or individually as organizations on some of those issues. Christine, you want to start with that one?
Sure. So one of the points that Michael had made earlier was that our organizations at different levels are involved with training. And one of the models that we look to from NAPCA is SAGE's National Resource Center for providing training to caregivers. We at NAPCA we haven't started anything official as formalized as SAGE has, but we are definitely, we have been focusing on providing language-appropriate materials, whether it's on how to access Medicare, how to enroll in LIS. We're doing written language materials that our community-based organization partners can share and disseminate with their constituents. And, of course, we're also counseling folks directly through our helpline, so that can be anywhere in the country. Yeah.
Michael, you have something to add to that one?
Yeah, I mean, I think there's a direct link between the important focus on caregiving and the coalition's advocacy with regard to the Older Americans Act, because, obviously the Act structures funding for local aging programs, and it's not always the case, but it generally is the case that local aging programs become the platforms for caregiver support programs, so that our efforts to increase the support for aging programs that are specifically targeted to diverse elder communities will, to the extent that they're successful, will definitely lead to support for caregiving within our communities. And the one other thing I would mention is that we are starting to have some conversations within the coalition around the question about policies with regard to paid leave, or the lack of policies that support paid leave for caregivers, which, of course, has a really detrimental impact on caregivers. And I think that we have quite a bit on our advocacy plate as a coalition, but several organizations have come to us, and coalitions, including Caring Across Generations, for example. We've been in conversation with Caring Across Generations about what kind of role that we can play to be supportive of their efforts, and also to ensure that their efforts are reflective of the particular needs of caregivers of diverse elders. So there's a lot of movement on that front.
And John, I'd like to just add and jump in where Michael spoke, because there are a lot of organizations that have the expertise in the issues that people are asking about, for example, long-term care and the caregiving. And it's not that this coalition, and I'm speaking for them probably best I can, but that it's not their issue to have a response on every issue, but it is one for them to be in communication with those groups that do have the deep experiences to have an exchange, and for the mainstream groups to hear what the needs are, tap deeper into the communities that they are probably serving and learn more. and that the DEC can also learn more about these issues, because I don't think they're experts in all of these either, and nor can they ever be. So there's a good opportunity, I see, for better connections, better collaboration to make the work that each of the groups do better in the field.
Well, great. Unfortunately, that's all the time we have for questions today, but before we close, I want to ask each of our panelists today if they have any final comments for our audience. Christine?
I'd just like to thank Grantmakers and Aging for the opportunity to discuss our work. We, as a coalition, have been working on a number of priorities, and because of Atlantic Philanthropy's support, we've been able to actually convene as a group formally and try to move a collective agenda forward. And so I really I appreciate the opportunity to share that discussion.
Michael?
Well, I would ditto Christine and add that one of the things that's been great about the questions that folks have asked is that they really are connecting the dots between the focus and the issues of diverse elders and broader aging concerns. And I think that's a really important theme to leave on, that these are particular communities with particular needs, but their concerns are very much integrated into broader aging discussions and need to be.
Stacey?
I'm an optimist. I think the glass is half full, and I think this is a great time for opportunity. We have a chance to get ahead of the curve in terms of addressing the needs of emerging populations. We talked about a few of those ways today to respond, and I hope that we'll have more conversations and see more of these kind of discussions happen in the future. And I just want to thank GIA for providing this venue for us to do that.
Well, it's been our pleasure. I want to thank Christine Takada, the President and CEO of the National Asian Pacific Center on Aging, Michael Adams, the Executive Director of SAGE, Services and Advocacy for GLBT Elders, and Stacey Easterling, Program Executive, U.S. Aging at the Atlantic Philanthropies, for joining us today. Thank you all for everything you do to make life better for the nation's older adults. I also want to thank the John A. Hartford Foundation and the Atlantic Philanthropies for their support of this program, as well as the American Society on Aging for their technical expertise.